Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, I'm excited that we'll be having an interview with Cheri Bantilan from Nutrisense, and we'll be discussing the use of a continuous glucose monitor and how this tool can help us to better manage our blood glucose levels for optimal health. Obviously, this can be super important in helping to manage patients who are diabetic or pre-diabetic, but it can also be part of a program for optimal health for longevity as well. As we know, there's many studies correlating lower levels of insulin and better managed blood sugar with less inflammation. There's even some data that we've discussed previously on a podcast, linking it with potential lower risk of cancer. And so for longevity purposes, better managing your blood glucose levels is an interesting thing to take a look at. It's one of the reasons why eating a lower glycemic carbohydrates and perhaps some of the specialized lower carb diets have been shown to have some benefits for overall health. Our special guest today is Cheri Bantilan, and she's a registered dietitian who works with Nutrisense. And Nutrisense is a company that helps patients to use a continuous glucose monitor and to interpret the data to optimize their health. A continuous glucose monitor is a device typically worn on the back of the arm or on the abdomen that monitors your glucose continuously all day and night. And when interpreted properly, can help you to learn how your blood glucose levels respond to eating certain foods, meals, timing of meals, activities, exercise, stress, sleep. And this fits very nicely into the functional medicine model, which aims not just to help patients with their symptoms, but to use the right testing to get to the root cause of their health issues. Welcome, Cheri.
Thank you. Thank you so much for having me here. I'm super excited to be here.
Excellent. So can you explain what a continuous glucose monitor is and which of the devices on the market do you find the most helpful or accurate?
Great question. So the continuous glucose monitor, or CGM, as we like to call it for short, is a small device that you basically put on the back of your arm or your abdomen, as you mentioned, and it's painless to insert. If people are familiar with checking their blood glucose levels, they're probably really familiar with glucometers, where you have to use a needle and prick your finger and check your blood in that sense. No needles are involved. You basically insert the device on your arm, and depending on the device that you have, it measures your glucose through the interstitial fluid of your body every 5 to 15 minutes. And therefore you get this nice plotted line of continuous data, which is really nice. It's pretty insightful. It's like having real-time data for yourself. And as I mentioned, there's a couple of devices out there. The two main companies that make them are Dexcom and Abbott. So there's a Freestyle Libre, which is what we use at Nutrisense. And then there's the Dexcom, and then there's various different devices between those two companies, but our company currently uses the Freestyle Libre. And both devices are very accurate in assessing changes in real time for your glucose. And each company has their own calibration system. At our company, we do find that many members have a fasting glucose lab value or a glucometer at home. So we also have a feature where you can manually calibrate your sensor to those metrics as well.
Oh, interesting. So when do you think are the most important times to look at for understanding our glucose levels. People often talk about the fasting level, which is when you get up in the morning prior to eating, the postprandial level, which is 2 hours after eating. Other diabetics check it prior to eating meals. When do you think is the most significant, important times?
That's a really good question. So there are three major trends that we actually like to follow. And as you mentioned, one of them is fasting glucose value. I would also like to tag on average daily glucose value on that and kind of keep them in the same realm. And then the next one would be, so fasting glucose would be anything without food or drink for at least 8 hours. Typically it's in the morning for most people. The next one would be postprandial responses, which is after meal responses. And we like to look at what your pre-meal value was, and then that 2 hour period after you eat. So we're looking at all those metrics within that time. And then the last one, which is actually very unique to wearing a CGM, would be glycemic variability or standard deviation. And you can actually only get this metric if you are wearing a CGM. If you have a glucometer at home, you can't get your standard deviation just because you don't have that continuous data. But those are the three metrics, and that the standard deviation is more of a metric that comes over time. It's not like a one stamp time type of metric. So it's really useful for measuring your glucose fluctuations or swings.
So I'm pretty familiar with what we see as as a good level or an optimal level for the fasting glucose, and that's typically what we measure when we do lab testing. How does that compare with average glucose levels? So like we typically think of somewhere between 70 and 90. I know there's different ranges that people consider optimal for fasting glucose levels. Well, first of all, what do you consider optimal for fasting glucose levels, I guess, for a healthy person versus maybe a pre-diabetic or diabetic? And then how does that compare with what we see as average glucose levels over the course of the day?
Yeah, so we agree. For optimal values for a healthy person, we like to see fasting level values between 70 and 90 majority of the time. Obviously, we know that glucose fluctuates, and there's reasons why it may be higher or typically higher for some people, depending on various influencers. But typically, we do want to see them between 70 and 90 most of the time. Now, daily average glucose would be something that takes into account your entire day. So that would take your sleep average and the rest of the day. And we like to see those values between below 105. So just a little bit higher, you're kind of taking into account the rest of the day while you're eating. It's very normal when you're eating for glucose to go up. So we don't expect it to be a flat line ever. We don't want that. So average glucose, we like to see below 105.
Okay. What should be the highest level we should see glucose levels rise after a meal? And ideally, how long should it take to come back to the previous baseline level?
Yeah, this is a really great question. So this is one of my favorite things to kind of look at and assess is different meal responses. And it can vary depending on like the meal content, meal timing, what you did before and after. So it's pretty interesting to see. But in general, we like to see for a healthy individual, we like to see postprandial responses stay below 140 majority of the time. And then we also look at how long it takes for your values to come down. So we like to see values return back to baseline or back to your pre-meal value between 2 to 3 hours. And if it's taking longer than that, there are nuances. Maybe you had a lot of fat in that meal. So it's just taking glucose longer to digest and be absorbed. And so that fat is prolonging that response. But there's different reasons why a response would stay longer. What we don't want to see is having your values spike to 150 and staying up there for 4 hours. Like that would be something that we would be like, okay, let's look at this. Let's dive deeper into this because then maybe there's something else going on.
Would you say with the type 2 diabetics that you manage, do their levels typically go back to fasting levels, or is that sort of once they start eating, it's always a little bit above that?
It depends on their health history and how well their diabetes is being managed. If it's pretty well managed, yes, we do actually see values come back down. And whether that's through lifestyle factors or medication, it's being managed and we are seeing those values in that normal curve that we like to see. For individuals who don't have their diabetes managed that well, it takes a long time for their values to come back down. And so that's when we would try to intervene through lifestyle interventions with diet, exercise, sleep and stress levels, making sure all of those components are coming together to make sure that their body is working as efficiently as possible.
So what you're saying is for a type 2 diabetic, it's really not unreasonable for us if they're properly managed, if they're really taking care of all the lifestyle and other factors that we know can play a significant role, that their fasting glucose levels should consistently be below 90?
So it's tricky. I think that depending on where they are, it is very possible. I feel like a lot of times when people come to us and they have a diagnosis of type 2 diabetes, they've been dealing it with for a long time, they feel like that is the end result. However, we can reverse this. We know that insulin resistance can be reversed. It does take time, just as it took time to have this, have it progress. It takes time for it to reverse. So it does take time, but it is possible.
Okay. And that should be the goal. We shouldn't say, well, because you're diabetic, if you get it to 105 fasting, that's probably the best we can do. I mean, we might have to accept that after a period of time, but.
Yeah. And depending how long they have been in this, have been dealing with this and how long it's been unmanaged, there may be nuances where, maybe we may never see it go below 90 just because there is a history of damage there physiologically. But that doesn't mean that you don't try for optimal. It doesn't mean that you can't achieve something close to it.
Right. So there's something that most people have heard of called the glycemic index or the glycemic load. And this is basically a measure of how quickly different carbohydrate foods are going to cause your blood sugar to spike. And of course, this is an average. It's the glycemic index is based on a 50-gram sample. So that's why they came out with a glycemic load, which maybe is more going to reflect the amount of the carbohydrate that somebody might eat in a meal. But from your experience working with, hundreds, maybe thousands of patients, how much variability is there in the glycemic index? When we see that, say, sweet potatoes are low glycemic, how often is that, how often do you see patients respond differently to different carbohydrates than we would expect from the glycemic index?
Yeah, absolutely. It's quite impressive at how everybody has a unique response. Truly. People often use the glycemic load or glycemic index as maybe like a first next step. Just maybe they're just trying to get used to navigating, a low carb diet or whatever it may be. But I always say, to test it out. Everybody has their own unique response. Don't guess, just test. That's our little slogan that we like to use because it is so true where everybody has a unique response. And yes, people may have different health backgrounds and, different situations where other factors may come into play, but it's really very fascinating to see how one food, for example, for me, bananas, they spike me. I can't eat a banana without spiking me, without a huge spike. But for a colleague of mine, she eats bananas and it's totally
I heard her say that.
And I think it was totally fine.
Dr. Ruccio's podcast.
Yes. And I'm jealous. No, it's fine. It's not a big deal, but it just shows it's very interesting how there's, two people around the same age, very similar backgrounds, and we just have different responses.
I've really been enjoying this discussion, but I'd like to take a minute to tell you about a new product that I'm very excited about. I'd like to tell you about a new wearable called the Apollo. And this is a device that can be worn on the wrist or the ankle, and it uses vibrations to stimulate your parasympathetic nervous system. And this device has amazing benefits in terms of getting you out of that stressed out sympathetic nervous system and stimulating the parasympathetic nervous system. It has a number of different functions, especially helping you to relax, to focus, to concentrate, to get into a deeper meditative state, even to help you sleep. And there's even a mode to help you wake up. And this all occurs through the scientific use of subtle vibrations. For those of you who might be interested in getting the Apollo for yourself to help you reset your nervous system, go to apolloneuro.com and use the affiliate code Weitz10. That's my last name, WEITZ 10. And now back to the discussion. I don't know if you've looked into this, but do you think, or have you seen that the way people eat and or digest their foods matters? Like if you eat quickly, maybe you don't have good digestive enzymes, hydrochloric acid function. Maybe you're not going to break it down as quickly, or somebody who chews their food more for a longer period of time in a more relaxed manner. Have you seen that makes a difference in glycemic response?
Yes, absolutely. And it's actually very interesting. So if somebody, for example, rushes through their meal, we tend to see, or I have tend to see a lot of people actually have higher responses because it's rushed. They're not relaxing during their meal. Maybe it's more of a stressful environment. And so they tend to have just more, I don't want to say aggressive, but just larger responses to this versus someone who's taking their time, having a relaxing moment. And, similar, do you think that's more likely related to say cortisol levels or stress, or is it have to do with how much you're breaking down the food as compared to not breaking down the food particles? I would say that in that moment, if someone's rushing, it would probably be more related to stress. If somebody has a history of any GI issues, maybe dysbiosis, inflammation, that would be something that be related to more, on that side of the spectrum where it's maybe a little bit more physiological versus, stress is physiological too, but, something that's a little bit more, physical in the terms of something else is going on in your body versus like a stressful moment and it's more acute.
What about like GI motility? Would we expect patients with SIBO, for example, to have a higher glycemic response, or would we expect SIBO patients with diarrhea to have a different glycemic response than SIBO patients with constipation?
Yeah, that's a good question. And we do know that there is some research out there that indicates GI issues such as SIBO does have an impact on glucose. Typically, with issues like this, it does end up being where glucose levels are higher and they have higher responses. And again, that's just more of a issue with malabsorption or things that should be regulated and working efficiently, and it's not. So yes, all of that comes into play. It's
like would slower GI motility mean they're going to, I have seen some data that correlates SIBO with constipation or IBS with constipation with gaining weight because of the slower motility, you absorb more of the calories from the food. Would it be the case that you'd also absorb more of the carbohydrates and see more of a blood sugar spike?
Yeah, I'm not sure on the specifics on that particularly. SIBO in itself is like a whole nother ball game, I feel like. And there's different types of SIBO, right? And there's different like hydrogen dominant, methane dominant, hydrogen sulfate, right? So there's so many different types. In general, if they're not able to break down, I guess what your question is, if they're unable to break down their food, would that cause a higher response? Or
if they have a slower motility, would they absorb more of the carbohydrates from the food?
Yeah, that's actually a good question. I haven't really looked into that specifically. From what I've found working with SIBO patients, I will say more that they tend to have higher glucose values.
Okay.
The actual mechanism, I'm not too sure, but
okay.
Yeah, that is a good theory.
When eating a meal, does it matter what part of the food you eat first? Like if you're having a meal with protein and vegetables and maybe some starchy carbs, I've always eaten like the protein first and then the vegetables and then the sweet potatoes, thinking that I want to get the good stuff in there first. But do you think that affects glycemic? Do you think that affects the glucose response?
100. Yeah, absolutely. 100%. We've done numerous experiments with this with our own members. And then even on top of that, there's a ton of scientific articles on that where meal timing or meal content does matter. So having your protein first, and then maybe having, like you mentioned, your non-starchy vegetables or something maybe with fiber, and then your carbs. We tend to tolerate carbs a lot better as a second or third thing eaten.
Cool. Let's talk about glucose changes that occur with working out. Let's say I go to the gym and I have a pretty intense workout for an hour, mostly lifting weights. How does that affect my glucose levels?
Yeah, so it's very common to see, a lot of people, if they're exercising pretty intensely, you can see your glucose spike and increase pretty high, actually. Sometimes we see levels all the way up to 160, and it can be completely normal.
You're talking about during the workout or after the workout or when?
During the workout. Mm-hmm. Okay. During the workout, we'll see a big spike and completely normal. What we want to avoid is we don't want to frequently hit levels above 180 because that's when you may be actually causing vascular damage. So, but if it's spiking to, anywhere below 180 and it's a pretty intense workout, very, very common. It's likely what's happening if it depends. So if you're working out in a fasted state, liver and muscles are likely breaking down glycogen to provide that energy for your workout. If you're working out in a fed state, you're likely using that food that you just ate for your energy instead. But in general, if anytime you see a spike from a very intense exercise, it's probably twofold. It's probably like just overall the stress on your body, but two, your energy demands are exceeding energy availability. So your body is just using those mechanisms in place to provide that energy needed.
So it's actually a good thing because you have these stored carbohydrates. Your muscles need the glucose right then to function. So it's mobilizing that glycogen. It's getting into the bloodstream. That's why you're seeing this spike, but then the muscles are utilizing it. And so over a longer period of time, that's a good thing, right?
Yes, exactly. And so we'll see that transient increase during exercise, but then overall a lower pattern for the remainder of the day. And just a side note on that, while we are when we see these exercise spikes, it's not the same mechanism. So it's not the same mechanism, I should say, as a glucose spike from food. So the majority of glucose spikes and the glucose disposal that we see from exercise is non-insulin mediated, while with food, it is we do need that insulin. So it's a little bit different mechanisms there as well.
And potentially that's beneficial because while all peptides, hormones are complicated and have probably beneficial and negative effects, in general, you don't want a lot of insulin around because it tends to be inflammatory.
Correct. It's one of those things where you want enough of it to get the job done, but you don't want too much of it. Correct.
Right. So how do different forms of exercise affect glucose levels? So let's say we have heavy weightlifting, we have high intensity interval training, we have lower intensity cardiovascular training.
Oh, great question. So typically for like any type of zone 2 training, thinking about this is like something like a walk, something that's pretty leisure, we may see glucose either stay the same or have a slight dip. So think about anything low intensity. That's kind of what you'll see, a level or maybe a little bit of a dip. For strength workouts, that's something that's a little bit more intense. We expect to see a slight increase in glucose. For something that's high intensity, and it all depends on the duration as well. But for something that's like short high intensity, we do expect to see maybe like more of a moderate to large spike. And then anything that's really long and very high, high, like for example, like maybe like a 45 minutes and above type of workout. It depends on the person. It depends on what type of fueling they did before. So I usually recommend for people to just test what they usually do out. And then we look at the glucose data, and then we can kind of adapt from there and figure out meal timing from there, because what we want to do is make sure that for these long workouts, their energy is sustained and they're able to have these quality workouts. So they're not bonking, so to speak. But we're also not overfueling as well, right? It's always like that tough balance.
Right. So typically when glucose levels go up due to a higher intensity workout, how long do they usually take to come down?
It's actually not very long at all. It almost looks like a meal response. So it'll typically come down. It'll peak maybe like right at the peak of their workout, and it'll come down within the next hour. So it doesn't last long at all.
So an hour after they finish the workout, it's probably back to normal.
It's probably back to normal. I would say like 1 to 2 there. For the 2 hours. Yeah. For the CGM, there is like because it measures interstitial fluid, there is a little bit of a delay between actual blood glucose, usually 15 to 45 minutes.
Oh,
so I always like to give that
45 minute delay.
Yeah. So there is a little bit of a delay. So I always like to give that buffer. But in general, it comes back down fairly quickly. If it is prolonged, I would probably look deeper into maybe their recovery tips or whatever they're doing for recovery isn't as, they need to kind of tweak that a little bit.
Right. So let's talk about stress and glucose levels. And I know one of the things I've seen sometimes working with some diabetic patients is sometimes they'll see their fasting glucose levels higher than they should be based on everything they're doing in terms of their diet. And sometimes stress will be a factor.
Yes, absolutely.
So, we've correlated sometimes with the bigger increase in cortisol levels in the morning.
Yeah. And that's often referred to as the dawn phenomenon, where you see this rush of hormones, cortisol, adrenaline, all these kind of things. It's kind of like your wake up hormones. But for individuals who have diabetes, what happens is those hormones are released. It causes a release of glucose, but then it just stays elevated. And so that is very common in the diabetic community. But stress does play a huge role in anyone, and it can have a very profound impact on your levels. The body copes. If you think about what the body is doing when it's under stress, right? It's increasing your glucose output. It's releasing all that from the liver. And then at the same time, insulin sensitivity is also reduced. So these two things combined cause glucose to stay in the blood. And it's very important, if we were running away from like a lion or something, but we were not really doing that anymore. We're kind of sitting at our computers, and maybe we have a stressful meeting, but we're not running away from anything. So it's helpful, but acutely, it doesn't have too much of an issue. There's not much things that we can do about it. But what we get concerned about is those chronic stressors, because that's when it can get dysregulated.
Right. So what have you found are the most beneficial ways to deal with that sort of issue?
For more chronic stress, we really rely on creating a really good stress management plan for many people. For example, I work with a number of surgeons, and so obviously they have a very high stress job. And it's really interesting to see that every time they go into surgery, they'll note it. And you can see that when they start the surgery, their glucose levels will go up, sometimes by 30 points, and it'll stay elevated, for several hours. And then as soon as their surgery is done, it'll go back down. And while, again, one of those things where they
and somehow I can't see all these surgeons popping cortisol manager capsules
or meditating, right, during their surgery. Exactly. So, those are more edge cases where it's very acute, and it's we know what the stressor is, and oftentimes it's taking away the stressor. That's what's the most helpful thing. However, it's their occupation. So a little bit of a different case, but for most people, it's figuring out what the stressor is and trying to find some type of technique, whether it's breathing techniques, meditation, yoga, going outside, going for a walk. It works. Something's different for everybody. Whatever sticks is what's going to be helpful long-term.
And what about when people sleep? What is typically their glucose pattern?
Yeah, so sleep is pretty interesting. We do know that poor glucose control or elevated glucose values impact sleep, and it's a bi-directional relationship. So poor sleep also impacts glucose values, unfortunately. And poor sleep could be from anything, right? It could be from chronic stress. It could be from maybe not getting enough sleep. Maybe it's disrupted sleep, like you're having more fragmented sleep. Those are all stressors that can impact and affect glucose values. So again, it's one of those things where there's things that we can do from a nutrition perspective where we're timing, right? So meal timing. So if we find that your values are elevated overnight and that's what's causing you to have poor sleep, let's play around with the macronutrient content of the meal. Let's move the meal up earlier. Let's do things like maybe go for a walk after your meal so we can get those glucose levels down. If it's more of other, for other reasons, sleep hygiene tips are always helpful, and implementing that is always helpful. So we can, we often discuss that with our members just to make sure they have a good wind down and sleep hygiene routine. It's all these things are cumulative effect. And I feel like a lot of times people undermine sleep and stress, but it has such a huge impact. And so really taking the time to dive deep into these is best for longevity, not just your health, but for longevity.
And sometimes if you're working with, like, say, diabetics, especially diabetics who are taking insulin, whether they be type 2 or type 1, sometimes the glucose levels going too low during sleep is a problem as well.
Yeah, absolutely. So we actually, at our company, we actually don't take any members who are actively taking insulin, but absolutely, we do have a lot of members that aren't on insulin, but have issues with hypoglycemia at night. And again, so it's kind of like, it's the flip side, right? We're working on, again, same things, macro content, meal timing, and how we can make those levels steady so you're not waking up at night. There's a lot of people that don't realize that they're waking up because their glucose levels are low. So we see both sides. Yes, for sure.
How does drinking a glass of wine affect blood glucose levels?
That's a great question. So, so it's not uncommon for people to, of course, have a glass of wine on a Friday night. And oftentimes when they do that, the next morning, their values are elevated, and they're very surprised about that. And I always like to remind members that it's completely normal. It happens. It basically, your body, in a nutshell, right? Your body, there's no place for your body to store alcohol. So it will always prioritize breaking down alcohol before other substrates. So it's very common to see elevated values the next day with any type of alcohol that you drink.
But you're saying from one next day, right?
Typically, it depends. Yeah, typically,
right?
It's
because
the next day.
Because I think what's in common thought patterns out there, what I hear people say is, well, alcohol turns into sugar. And so I think they're thinking that you're going to get this rapid rise, but it turns out alcohol, unless the alcohol you drink can contain sugar, it actually doesn't turn into sugar. It gets metabolized differently, right?
Correct. So if you're having something like typically like wine, anything like hard liquor, we do actually see a dip in glucose, and then we see those elevated levels of it the next day. For things that are like sugary cocktails, because as you mentioned, there's actual like sugar and things added in there that would impact your glucose very quickly. We will sometimes see like those higher levels and then a dip and then higher levels, but it depends on the type of alcohol. Wine is very common one that we see people drink, or beer is very full of carbs. And typically beer is also drinking with other high carb foods, like beer and pizza is a very common combination. And so you'll see elevated values probably right after the meal and overnight and into the next day.
I'd like to interrupt this fascinating discussion we're having for another few minutes to tell you about another really exciting product that has changed my life and the life of my family, especially as it pertains to getting good quality sleep. It's something called the Chili Pad, CHILIPAD. It can be found at the website chilisleep.com, which is CHILISLEEP.com. And so this product involves a water-cooled mattress pad that goes underneath your sheets and helps you maintain a constant temperature at night. If you've ever gotten woken up because the temperature has changed, typically gets warmer, this product will maintain your body at a very even temperature, and it tends to promote uninterrupted quality deep and REM sleep, which is super important for healing and for overall health. And if you go to chilisleep.com and you use the affiliate code Weitz20, that's my last name, WEITZ 20, you'll get 20% off a Chili Pad. So check it out, and let's get back to this discussion. Now, explain physiologically why you would see elevations in glucose levels the following day after drinking a glass of wine with your dinner.
Great question. So, as I mentioned, it depends on the alcohol that you're drinking, but many people will see that glucose elevated because your body is basically prioritizing down that alcohol over normal glucose production. The studies that we have on this show that alcohol temporarily impairs the normal functions in the liver to moderate normal glucose levels. And so it balances that insulin and glucagon. And so it appears that what happens is when you drink alcohol, it temporarily interferes with liver gluconeogenesis, and which is making more glucose, and glycogenolysis, which is breaking down stored glucose. So what happens is the liver prioritizes breaking down that alcohol over other normal homeostasis functions because the alcohol doesn't have a place to be stored in the body.
And so this has been described in some articles as drinking a glass of alcohol prior to a meal reduces postprandial glucose response as possibly a positive thing, but you're saying it's actually a negative thing.
It's funny. I have seen things like that. I have seen people's thought processes in that way as well. And I will say that everybody has a different alcohol threshold. I wouldn't use drinking alcohol as, prior to a meal as a technique or tactic to lower your values. Some people get away with it.
So now the reason why the glucose levels go up the next day is because it took that long to process the alcohol, or it's because it wasn't processing the carbohydrates till later?
Yeah. So basically everything is pushed back, right? Your body is prioritizing the alcohol. It's breaking that down. And then you have all this leftover glucose in your body, from eating whatever you were eating. Maybe you're eating pizza. And so you have all that leftover glucose in your body. And so it's just hanging out there. And so that's what we're seeing, right? Your body just wasn't able to prioritize that because it was prioritizing alcohol.
So in the functional medicine world, and I'm sure, a lot of consumers as well, we often use specific nutrients to help with the management of glucose insulin levels, like berberine, cinnamon, chromium, vanadium. Have you seen, looking at patients with a continuous glucose monitor, that any of those specific nutrients have a particularly beneficial effect?
Great question. So the supplement that I have seen them have the most impact would be berberine for sure. And I typically, if individuals are pre-diabetic or they're having really high values and we're doing all the lifestyle factors and they just need that extra push, we discuss that with their physician as well to see if they're a good fit. But that is the one that I see to be most effective majority of the time. There are some studies that show that like cinnamon, alpha ALA, like chromium, things like that, all those things, bitter melon, that's like another common one.
Right.
There's less studies on that. I haven't seen, it's also probably like a dose factor. A lot of people, the effective dose of cinnamon for impacting glucose, people probably aren't consuming. So it's,
right.
it's
meaning you need maybe, some of the studies show 2 to 3 grams and people are probably consuming, milligrams.
Yeah, they're probably sprinkling it on their coffee. They're not eating it, a ton of it.
Right.
The other one that people do often, and I have seen, it's kind of a mixed bag with this one, is apple cider vinegar. Sometimes people will, use that as a tactic in their salads. It's common, so it's easy to add, and that has shown some impact as well for some people, but it's not the most effective one that I've seen consistently is berberine.
So on the berberine, can you comment about dosage and frequency?
Yeah, absolutely. So therapeutic dose would be about 500 milligrams, 2 to 3 times a day. The majority of the studies on berberine are done in type 2 diabetics. So I always like to make sure that the member who is doing it is aware of that. And the most common symptom with taking berberine is just some GI upset. So if anyone ever experiences that, that means it's a sign that you just need to back up a little bit on the dosage. And you should be taking it with food as well.
And do you recommend before, after the meal, with the meal? And do you ever go to 1,000 milligrams or higher dosages? And have you seen a beneficial effect with that?
Yeah, that's a good question. I typically only recommend staying around that 500 milligrams 2 to 3 times a day, just because of the GI issues that a lot of people do experience with higher dosage. And yes, always with meals. It doesn't matter if it's before or after, as long as it's you're not eating on it or taking it on an empty stomach.
Now, I've seen studies that show that berberine has a similar effect to metformin. Mm-hmm. I've also seen studies showing that taking berberine with metformin actually enhances the effects. Can you comment about that? Have you had any experience with type 2 diabetics who are taking metformin, also taking berberine?
Yeah, that's a good question. So you are completely right that the mechanisms are very similar. Berberine has very similar mechanisms to metformin, which is why it seems to work so well. Also, side note on that, sometimes if anyone is taking it out there and they've been taking it for like a couple of days, sometimes it can take a couple of weeks for it to show any type of effect. With that being said, I always double check with the member that they're touching base with their physician if they're taking metformin and berberine, just because it's 2 medications / supplements that have the same effect. And so we want to make sure that, we want to have glucose levels manageable, but we don't want it being, dipped too low as well. So I always refer to the physician in terms of medication. And if it's okay with them, then and they can take berberine at the same time, then I'm all for it. But I never recommend, taking it at the same time without touching base with their physician.
And I ditto the same. Of course, we always want to check with their physician, and patients should always check with their physician before taking any supplements, even if their physician doesn't know anything about them. So sometimes I'll include a paper that they can give their physician. Okay. Let's see. So I think those are the main questions I had. I often use berberine as part of a longevity program as well, because, metformin's often used off-label for longevity purposes as well. Yeah. Mm-hmm. So your company, can you explain a little more about what your company does exactly?
Yeah, so Nutrisense is a company where you can get CGMs from. So basically, historically, CGMs are only used in the diabetic population, but we have found that it's a very great tool to be used for optimizing health and for preventing, progression of specifically, insulin-related diseases as well.
So you're saying for like the average patient out there, they can't just buy one at the pharmacy.
Correct. You cannot get this over the counter. You do need a prescription. So what our company does, it takes care of that prescription for you. You go to our website, there's a form that you fill out to make sure that you meet certain criteria, and our team looks at that, and then we take care of that prescription for you, and the CGM is sent right to your door. And every person, every member that has a plan with us will get a complimentary dietitian for 1 month. And
now,
so
do you have to have blood sugar problems or pre-diabetes or diabetes to get one?
Nope. You can be, you don't have to have any of those. The only criteria we have exclusion criteria, which is basically you can't be actively pregnant. You have to be over the age of 14. You can't have, actively be on any type of cancer treatment. So those are the basics of the exclusion criteria. But other than that,
biohackers qualify.
Yeah. Biohackers, if you're interested in wanting to, there's a lot of people that are interested in meal timing with exercise, enhancing their exercise performance, and they don't have any type of health history. All types of people we work with.
That's cool.
Yeah, it's fun.
Okay, great. So how can our listeners and viewers find out about your company? I don't know if you want to give them your contact information as well.
Yeah, absolutely. So to sign up, you can just go to www.nutrisense.io, and all of our plans are listed on the website. You can definitely choose one. And then from there, you'll fill out the form. It's pretty self-explanatory, and it'll be shipped right to your door, and you're paired with a dietitian. Of course, if you want to work with me or want to work with somebody that you've heard of, you can always request that as well. But other than that, it's pretty easy. The website's pretty easy to follow, and you can.
How does your company interface, say, with functional medicine practitioners?
Yeah, great question. So a lot of the dietitians that we have a functional background. In fact, I want to say majority of them have a functional background, and so we are very.
But what about functional medicine practitioners who don't work for your company?
Oh yeah, absolutely. Right. We do have affiliates, and we do work with them. So if that's something that you'd like to provide, like a code for your members or for your clients, then we can definitely set that up for you, and we can get a code for you. We can touch base with our marketing team and get that for you and your clients.
How would that work out exactly?
We would just give a code. So at checkout, it would be probably like your last name, and then so that when they check out, they get like a 20% discount or something like that. It depends on what it works out to be, but.
And would we be involved in, the recommendations that they get?
So the member or the client is always, if they want to share it with you, they can definitely share it with you. And then if they want, as far as like the dietitian working with the functional medical practitioner, we don't have an interface with that at the moment. But usually what happens is the member or the client is that medium between the two. Right.
Yeah. You might consider that in the future.
Yeah. Yeah.
Okay, great. Thank you, Cheri, for joining us.
Thank you so much for having me. It was really fun.
Yeah, I had a good time too. And I'll send you links to the podcast when we post it in a few weeks.
Okay. No
problem.
Hopefully
you can share that with your followers.
Absolutely.
Thank you.
Thank you so much.
Day. Okay.
You too. Bye.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. And if you enjoyed this podcast, please go to Apple Podcasts and give us a 5-star ratings and review. That way, more people will be able to find this Rational Wellness Podcast when they're searching for health podcasts. And I wanted to let everybody know that I do now have a few openings for new nutritional consultations for patients at my Santa Monica Weitz Sports Chiropractic and Nutrition Clinic. So if you're interested, please call my office, 310 395-3111 and sign up for one of the few remaining slots for a comprehensive nutritional consultation with Dr. Ben Weitz. Thank you, and see you next week.